Every year, Southampton eye specialist Richard Newsom travels to Africa to perform sight-saving eye
Well,
surgery.
blindness in developing countries is really tough because there's no social security. Quite often, the family has to pull out the elder daughter from school. So the elder daughter's education is damaged because they're having to look after a blind grandmother. The grandmother or the grandfather can't work around the house. They can't do their normal thing of running their farm or their small holding. So it becomes a real struggle. And the death rate when people become blind is really very high indeed. Pochery was a lady who came. She's a relatively young lady who'd just given birth. She had a 1-year-old child. But what was sad about Pochery is she'd never seen her child. She was blind in both eyes, one eye through trauma, and the other eye had an early cataract in it. So after a lot of examination, a lot of careful thought, we did some cataract surgery for her left eye, and the operation went well, and she began to see things after the surgery, and suddenly she could see her baby, she could have a look at her baby's feet, and she could begin to care for her baby in the way that she always wanted to. So it was a very thrilling time, and a lot of the staff were really rooting for her and hoping that it was going to go well. And these patients only get one chance to see an ophthalmologist maybe in their lives, and so we have to get it right. So it's quite a lot of pressure for us, but it's fantastic when you see a patient and they can see to the bottom of the chart and you know they're going to be set for a long time. That's a wonderful feeling, and it's why I volunteer every year. It's just wonderful.